I will give you an example of what insulin does. Assuming you have head of sheep, you know, insulin is like a header, a shepherd that controls the sheep. Okay, and this sheep is the glucose that is produced from the carbohydrate, from the food you eat. So what the shepherd do every night on coming back from feeding, it will harrow the corals, that is the heads of sheep, into their corals where they're supposed to be. But assuming that one of the sheep, the errant one, decided not to go in, what will the shepherd do? He will use stick, he will chase the sheep around the field to get it enter into the corrals. And what will happen? Assuming that that field is the field behind you, the stumps of the feet of the shepherd, that of the sheep, will destroy these beautiful grasses you are seeing. That green vegetation will be what? Destroyed or will be damaged. So that is what happens in our body. Okay, when this insulin is trying to pick those glucose for storage and it's not sensitive, the cells are not sensitive to it, what will happen? The islets will push out so much of this insulin into the system. It will damage the vessels. The vascular system will be affected, and that will lead to retinopathy. You find somebody is diabetic, and the end stage, the person will start having eye problem with sight. That is retinopathy. Nephropathy, the system start cutting off blood supply to the nephron, to the kidneys, and the person will start having nephropathy. The kidneys will become incompetent to do its work. And equally, the extremities, like the feet, the hands, will start losing sensation, loss of blood supply, and that will start causing sore and damage. So let us give ourselves advice. We don't have much time for long talk. I've just enlightened you, know what diabetes is now. The advice is now, how do we prevent it? How do we manage it? One, if you are diabetic, as we are doing exercise, you are not supposed to exercise in an airport if you are diabetic, because it will cause ketoacidosis. Your body will start producing keto acids, and that will be a toxin to your body. So if you are diabetic, it's good for you to indulge in exercise, but first of all, take something. A piece of bread with a glass of milk is okay. Then you join the exercise. Then if you are not diabetic, we are talking about how do you prevent being diabetic. One, there are risk factors. Like the most common risk factor in our area is our diet. Our diet. We're supposed to change certain things about our diet. Timing is very, very necessary in nutrition. When do you take your meal? What is the components of your meal? You're supposed to eat a healthy, balanced diet. Portioned. In Nigeria, we don't portion our meal. You go to the market, you come back, they will give you one plate of fufu with tofu onubu. You finish it. And at the end of the day, you are tired. You just stay there and they sleep off. One, we are supposed to eat 3 times in a day or even 4 times in a day. It's better and it's good for you to eat in the morning. That morning, make sure you take your breakfast. Breakfast is very, very important if you want to prevent DM. Breakfast is very, very important if you want to lose shape. Timed feeding is very, very important if you want to lose shape. Portioned meal, the amount of food you take, the intake, is very, very important if you want to lose shape. Another risk factor for DM is obesity, overweight. That is why all of us are here, to reduce our weight. When you are obese, the fat cells become more insensitive to the action of insulin. And that will lead to what? Accumulation of glucose in the blood. And when glucose accumulates in the blood, it damages tissue, the vessels, even your normal cell tissue, the retinas, the kidneys, it will damage them. So I've mentioned meal. We have to time our meal. You have to take carbohydrates in the right proportion, protein in the right proportion. Most of the times, the best thing for us to take is much of fruits and vegetables and fiber-containing meals. When you take fruits and vegetables and meals that contains fiber, digestion is fast, assimilation is fast, degradation is fast also. Another thing we have to take charge of is there are other risk factors. Stress. Many of us do work in a place where we sleep at night, so we don't take. The body has been conditioned based on nature that from 8 o'clock, 9 o'clock, the body starts shutting down. The body wants to rest. When you don't do that, you stimulate the production of cortisol and some glucocorticoids that will influence the action of that insulin, and that will lead to. So here we are doing something like stress management. Apart from losing weight, coming here is an social aspect where you interact with others, you reduce the stress that is in your body. Another thing we have to take note of is other ailments that will bring us to diabetes. Like we have gestational diabetes. If once you are pregnant and you are having diabetes as a result of that, just have it in mind. There is a possibility of developing diabetes. So from that time, you start to take charge and be conscious of certain things. So we've mentioned things that are very, very important. And when you are doing this exercise, you need water. If you don't take water and you are exercising, there is reduction in the amount of, when there is a catabolism, there is need for water that will facilitate the breakdown of those fat cells. So when you prevent all those things, you take care of yourself, reduce the use of refined carbohydrates. Most of our meals are refined carbohydrates. We eat indomie, we take ice cream and stuff like that. So without taking much of your time, our take-home assignment is that is the intervention. One, the exercise you are doing is okay. Work on your meal and your timing. After 7 o'clock, we are not supposed to take anything again. Work on your meal, the portioning, the timing, the content of your meal. Secondly, as we are doing now, reduce weight. Try to